So how did that make you feel? Nervous? Well, haven't you been taking those medications that I gave you? What? You're too nervous to take them? You know what, buddy? No more doomsday preppers for you. It has made you into an incredible mental case. My goodness gracious. Our hour is up, for him at least, but not for us. I'm Joe Alton, MD, also known as Dr. Bones, the disaster doctor of doomandbloom.net, where you'll find over 400 posts on medical preparedness in times of trouble. I'm also the co-author of the Survival Medicine Handbook, the #1 bestseller in both survival skills and safety and first aid on Amazon. And of course, this beautiful thing is the famous TD Bird, my good buddy. And of course, there's this guy who'd be chewing his fingers to the bone if he wasn't already bones himself. Today I'd like to talk about anxiety in survival situations. If you've ever had something to worry about, you know how it might have affected your work performance. In survival scenarios, less than 100% efficiency is going to put you and your family or group in big trouble. It's a rare individual who won't experience significant anxiety when deprived of the benefits of modern civilization. Anxiety is really a hodgepodge of related symptoms, so sufferers may present to you quite differently from one another. The symptoms may be mostly emotional, they may be mostly physical, or some combination of both. Here are some of the various things that you might notice. Emotional symptoms such as irrational fears. I knew someone who used to worry that their ceiling would fall down on them during the night while they slept. Difficulty concentrating, jumpiness, extreme pessimism, irritability, mental paralysis and ability to act, or the opposite, the inability to stand still. Physical symptoms include shortness of breath, palpitations, perspiration, upset stomach, diarrhea, tremor, tics, twitches, tense muscles, headache, and sleep deprivation or insomnia. Acute anxiety attacks, also known as panic attacks, may occur without warning and are characterized by intense feelings of fear and impending doom. Panic attacks are usually short-lived but severe enough that a person may feel what they believe to be physical chest pain. These patients are usually young adults and will appear to be hyperventilating or may complain of chest pain and feeling faint. Patients with panic attacks have some classic complaints besides chest pain. Choking sensations, feeling that they're in an unreal or surreal environment, like right here maybe. They feel the walls close in on them, otherwise known as claustrophobia. They feel that strange pit of the stomach, nausea, queasiness feelings, hot flashes, sensations of heat and flushing, things like that. Panic attacks may last an hour or more in severe cases, but a single episode will usually be quicker than that and resolve without medication. Now, despite this, the most successful treatment of frequent attacks appears to come from a combination of medications and supplements, both anti-anxiety and antidepressant, and behavioral therapy. Now, unless your patient had a history of anxiety problems pre-collapse, you won't have stockpiled many anti-anxiety medications like Xanax. As such, you should look to your medicinal herb garden for plants that may have a calming effect. Alternative remedies also include things like massage therapy combined with herbs such as valerian, kava, lavender, chamomile, and passion flower. Any herb with a mild sedative effect might be of use in this situation. Essential oils used as aromatherapy might also be helpful. These include bergamot, cypress, geranium, jasmine, lavender, rose, and sandalwood. Basically, you take these versatile oils and use them as direct inhalation therapy or for topical use. In other words, just rub the oil between your hands and bring your hands to your face and breathe deeply and slowly. For topical use, a 50-50 mixture of any of these essential oils with a carrier oil such as olive or coconut will be beneficial when applied on temples, neck, and shoulders twice a day. A multiple number of teas are also known to be especially helpful in people with anxiety disorders. The following are all reported to have a calming effect and help with sleep: catnip, valerian root, fennel, passion flower, ginseng, lemon balm, mullein, peppermint, lavender, and verbena teas. Drink the tea warm with honey, 1 cup 3 times a day as needed. Perhaps most importantly, you'll have to treat your anxious patient with good counseling technique. When you have an honest conversation with your anxious group member, listen calmly and attentively. Ask them to tell you exactly what they're worrying about, and then have them write down those concerns on paper if they can. Sometimes just the act of acknowledging their fears and seeing them in black and white will help them and you resolve some of their concerns. Your validation and support, medic, will also help you earn something very, very important, and that's trust. There'll be items on their list, of course, that will relate to the uncertainty of their current situation. Now, here's some important advice for good times or bad. Inform them that there's always some uncertainty in life, no matter what the times are like. Try to convince them that dwelling on those issues is not going to make anything less uncertain, but will prevent them from functioning normally and helping the success of the group or the family. Convince your patient to set aside just a short part of their day to concentrate on their worries with their list in their hand. Keep that time period limited to maybe 10 minutes or so, and then have them concentrate on productive activities of daily survival. With luck, they'll think less of their fears the rest of the day. You should work to improve your patient's quality of life, of course. You can do this by assuring good nutrition, reducing substances such as nicotine, caffeine, and alcohol in their systems, encouraging exercise and constructive activities, promoting rest breaks and good sleep habits, instituting sessions of relaxation therapy like meditation, massage, or deep breathing. You might consider some of this advice a little too hippy-dippy for you, but believe me, it works. Take it from me, the survival medic will be dealing with anxiety and depression a lot more often than they'll be dealing with gunfights at the OK Corral. Keep an open mind and open ears, and you'll help your group member be more efficient, and you will succeed even if everything else fails. This is Joe Alden, MD, also known as Dr. Bones of doomandbloom.net, wishing you good health, no matter if it's good times or bad. And hey, don't forget to follow us on Twitter at Prepper Show and Facebook at Doom and Bloom. Thanks for listening.